Hi, I am Dr. Nitin Annarapu, consultant cardiologist at Isha Clinic, Hyderabad. Coronary angiogram, or also routinely called as angiogram, is a test to detect any blockages in the heart vessels. This is usually done in patients who complains about chest pain, at rest, or during exertion, or they are going for any heart related surgeries, and if the patient had any abnormality in ECG, 2D echo and treadmill test, this test is done. Prior to the test, you have to be on fasting, that means empty stomach for 3 to 4 hours, and this is a very simple procedure and very safe procedure. During the procedure, we'll give a local anesthesia either at the hand or thigh. The test can be done either the blood vessel which is located on the hand or thigh, so which goes to the heart. We'll make a small puncture or incision at the wrist or the thigh, and then we'll place a small plastic tube called sheath into the blood vessel of the wrist or groin, and then we'll pass a catheter or a small plastic tube through that artery into the heart vessel which supplies the blood circulation to the heart, that is also called as coronary arteries. Then we will give a dye, that is a contrast material, so which makes your blood vessel to be visualized during X-ray. During an angiogram, we will take multiple images using X-ray machine, and as the contrast material passes and fills the coronary arteries, then it will take multiple X-rays to visualize the coronary artery anatomy. By seeing these images, we can make out whether any coronary artery is completely blocked or it may be narrowed, and then we will also assess the length of narrowing and severity of the narrowing, and by assessing these blocks we will advise whether the patient has to go for only medicines or patient has to go for any balloon angioplasty and stenting, or some patients may go for bypass surgery. After doing the angiogram, we will remove all the catheters or sheath, the plastic tubes which we placed during the procedure, and then we will apply a pressure bandage that has to be in place for minimum of 6 hours. Usually we will ask them bandage to be removed the next day before taking a bath, and after procedure we will observe in a recovery room in the chair or bed for minimum of 2 hours, and then if there is no complaints we will discharge on the same day. It's usually done as a daycare procedure, that means patient will be admitted on the same day and discharged on the same day. Usually it takes around 6 hours of hospital stay. The angiogram procedure, it takes around 10 to 15 minutes only, but you will observe for 2 hours post procedure, and you have to inform the doctor if you have any severe chest pain at the site of angiographic site, and any pus discharge or swelling at the site of the angiogram, and if you have any fever immediately after the procedure, you have to inform. So otherwise it's supposed to be very safe procedure.